get into the details. And this afternoon is a worrying situation about Ghana's COVID-19. On the eve of Christmas alone, as I was telling you, as many as 1,264 people in Ghana caught SARS-CoV-2, that virus which causes COVID-19. 3 others could not survive it and died. That's the current situation as the virus continues its spread through the country in the 4th wave, which we are told is officially with us. Experts are warning many more people will catch the virus in the coming days and weeks. Director of Public Health at the Ghana Health Service, Dr. Franklin Asiedu-Bekwin, says the new strain, which is the Omicron, may be driving the current wave. He spoke to me earlier.
Clearly, you can see that there's a perpendicular rise in cases. So if in terms of nomenclature, then we are in it. I mean, if you look at the shape of the curve, we are now a different shape than we have 2 or 3 weeks ago. I remember speaking that, you see, what we are experiencing now is better than last year. The difference is that now we have vaccines. Last year, we didn't have any vaccine. So if you push our vaccine coverages up, though we may have increasing cases, the severity will be low, and there will be less death. And I think that's what we need to focus our attention on. We make sure that we get vaccination numbers very high. People will be infected, but there will be less severity.
So that's Dr. Franklin Asiedu-Bekwin there speaking earlier. So I spoke earlier also to the head of our health desk, Fred Smith, on the regional situation. He will also join us, but let's take a look at what the situation is.
That's where we have majority of our cases. In fact, in the latest updates released by the Ghana Health Service, that's where about more than 90% of the cases are. It's followed closely by, well, not closely, it's followed by the Ashanti region, where you can see the map a bit faded.
Yeah.
That's Ashanti region. And then the greener it is, the less cases you have. As we speak, we have only 1 region without a case. All the 15 regions have the case, except the Northeast region. In fact, since the outbreak, Northeast has been the region with the least number of cases, less than 300 cases since March 2020. And as we speak, they have no active case. It could be that the people practice the protocols to the best of their abilities, maybe some other reasons.
Okay, so that's head of our health desk, Fred Smith. Well, there are more developing issues, so we need him live on this situation because he's been monitoring our current situation and the dashboard. Fred, so briefly, I know we've been talking about the breakdown as it stands now. More worrying is the numbers that we've recorded on Christmas Eve alone and the deaths that we've also seen, 3 of them. 1 is still enough to be worried about it. Fred, walk us through the current situation as we have it. Hello, Fred.
As you can see, we are over 8,500 cases, active cases so far, and that was that's like 3 times the increase since the last week. As many as 22 people have also died in the last 1 week alone. So that's very worrying for us. We are seeing a situation where the Greater Accra region, especially the center of Accra, having a number of people contracting the virus. In fact, more than 90% of our current cases are located in the Greater Accra region. And as you saw in that map there, it's followed by the Ashanti region, and then the other regions follow. So far, MFR, we have all the regions in Ghana having cases, with the exception of the Northeast region, which we will be discussing a bit later.
I'm interested in knowing why the Northeast region has not recorded any case, but you've been interacting with health experts and analysts on this particular New Year's Eve record as we have it, bringing our active cases toward 8,000 as it stands. What indications have they given you in terms of activities that could have led to where we are?
Well, on the eve of Christmas, you know, a lot of people keep awake. Some decide to go to the pubs, other drinking bars, games, meeting with family members, and so on. All of these activities are those that will help the virus to move from one person to the other. it is the mode of spread, making contact with other people, especially if you are not wearing the mask or you're not observing the protocols. And so these are the reasons why we may have had such a huge number of cases on the eve of Christmas, Semefa.
Okay, well, but how about the impact of this on our healthcare delivery system? What have they been saying? Do we have it under control, they'll say?
Well, as we speak, we have only 17 people whose case is severe. That's just 17. Previously, we had very high numbers in the region of 70s, but it's gone down. In fact, the number of persons whose situation is critical has gone to 0 as we speak. But we continue to have people dying. On a daily basis, we have 2 or 3 dying per the reports sent by the Ghana Health Service. So yes, we're not seeing a huge impact in terms of a lot of people at the hospitals burdening the health system, but we are also getting people who are dying. So we need to be concerned.
Okay, well, so that's the situation. But you were mentioning earlier that we'll take a look at the Northeast region and how come they do not have any case as it stands now. What understanding are you getting for that?
Well, shortly we'll have the Northeast Region Director of Health joining us to explain to us what they've been doing. But from the look of things, it appears that the Northeast region is doing something that is good. We don't know exactly what it is, but something good is happening there. So far, they've had 286 cases since the outbreak in March. That is impressive. And of this number, there's no active case in that region. When we get to speak to the regional health director, I'm sure this will be made clear to us.
And I can't wait for that. Fred Smith, as always, many thanks for your company. That's the head of our health desk here at the JoyNews channel. Fred Smith, always on hand to give us the very latest when it comes to our COVID-19 situation in the country. And like he indicated, we'll be taking a look at the Northeast region in particular and what may have accounted for their low cases or no cases as it stands. So the Greater Accra region is still in the lead when it comes to COVID-19 spread, and there are already calls for some sort of localized lockdown for it. Some analysts are actually divided on that particular measure, but you've been told about what really may have accounted for the Christmas Eve surge, and we've hit our record high. And we are still peaking when it comes to the number of COVID-19 cases, largely as a result of the new strain, which is the Omicron. So it's a good time, if you're not wearing your mask, to grab it and also adhere to all the protocols. And if you have not vaccinated as of now, is a good time to do so. So these are the curves and the indicators as we have it on your screen is our current COVID-19 situation as a country. Our active cases, the number of deaths, even though pretty low. We have severe cases and then those also in critical condition. But the active cases are soaring by the day. As we stand now, it's at 8,000, over 8,000 cases. Just yesterday, we are about 7,000. But now, because of the Christmas Eve figures that have been added by the Ghana Health Service, that is where we stand now. Over 8,000 cases as a country. What could be accounting for it? Is it that we are all not taking COVID-19 seriously as a country? What could have accounted for that situation, knowing that there are a number of measures that have been put in place? Is a good time for us all to pick up our safety protocols. We pick it up once again and get to work on it when it comes to COVID-19. Once we have the all clear, we'll head to the Northeast region and speak to the Northeast Regional Health Director on what could be done or what is being done or what we can learn or all learn from the Northeast region on what exactly the situation is. That's what we are as we stand now. We need to be able to check what the Northeast region is doing and what we can all learn from it. And as it stands now, the Christmas Eve story that I've been telling you about, and then also the Northeast situation. But my colleague, Erastus Asaridonko, has been following up on this particular story, and Ohiming Terrier as well. He's joined me on the phone. Ohiming Terrier joins us on the line with further details on this latest development. Ohiming, what's the situation as we speak when it comes to COVID-19?
Thank you, MFA. The situation is not pleasant at all because for the last 1 week or so, the period between 20th and 26th December has seen the Ashanti region recording 559 newly confirmed COVID-19 cases in the region.
Hello, Ohiming. So you have my colleague Ohiming Teria bringing us up to speed on the COVID-19 situation in the Ashanti region in particular. We know it's the second highest. It's leading after the Greater Accra region when it comes to COVID-19 in the country. As it stands now, the Regional Security Council in the Greater Accra region are putting measures, including a total shutdown of beaches. We know that there's a pushback for that particular directive, but the regional minister is unrelenting in that regard, hoping to flatten the curve when it comes to COVID-19 in the Greater Accra region. But in the Ashanti region, Ohiming Teria is just bringing us up to speed on what exactly the interventions are when it comes to COVID-19 and the numbers that have been recorded there. And Ohiming Teria joins us back on the line. We lost you momentarily, Ohiming. So you are giving me updates in terms of the figures that have been recorded in the region. Hello, Ohiming.
Hello, MFA.
Perfect. I can hear you now. So please walk us through it as you were telling us earlier.
Yes, as I said earlier, if you look at the situation between...
Okay, so it appears I've lost Ohiming again. Ohiming, can you hear me? Okay. Please bear with me. I've just lost Ohiming Teria. We're dealing with machines and it happens sometimes. I'm sure they want to go on holiday as well. But we have to still continue and bring you all the updates on it. So we'll rework the lines once again and bring back my colleague Ohiming Teria. I'm very interested in the situation in the Ashanti region because we have a number of revelers also there. And there's a total disregard in some cases for the COVID-19 protocols.